name's Barry. I'm going to be a nurse today. I'm going to do a quick assessment here. I'm going to start with your head, kind of work my way down your body. I'm going to do cranial nerves, listen to your heart, your lungs, and do some reflex testing, okay?
Okay.
First thing I do, wash my hands. Make sure the patient has privacy. We close the door. If I need to cover him up, I would cover him up. So I want to start with the cranial assessment. First thing I want you to do is just take your nostril and close one side and breathe out the other. Are you able to breathe okay? And do the other side. Okay, good. Now the first thing I'm going to do is have you close your eyes. I'm going to have you smell something, just testing your first cranial nerve, the olfactory nerve. Okay, good. Put your finger over one of your nostrils. Okay, good smell. Okay, what do you smell?
Cinnamon?
Yep, okay, good. Okay, and I'll do the other side. Now, I just would do the other side, that's all right. Go ahead and cover your nose again. I'll have you smell the second object. Good, smell it. What do you smell?
Suntan lotion.
Okay, good, great. Okay, the second test we're going to do, the optic nerve number 2. I'm going to check your vision here, okay? First thing I'm going to do, if I had a Snellen chart, I'd have you look at the Snellen chart 20 feet away, check your vision. But I'm just going to have you, I would dim the light if I would need to. I'm just going to have you go straight ahead. Check your pupil reflex. They can constrict equally, okay? And I'm just going to have you just kind of keep your head straight and kind of follow my fingers over here to the side. Okay, good. That's good. The third test I would do would be cranial nerve 3, 4, and 6. I'm checking your ocular, trochlear, and abduction. So I'm checking your eye movement. Okay, I'm going to have you keep your head straight again and follow my finger, okay? I'm checking for any stigmas, abnormal movement. Okay, good. Okay, good. Okay. And next I would check cranial nerve 5, which is the trigeminal. We're checking your masseter and your facial sensation. So I'm just going to kind of push in your temples here. Can you open and close your mouth for me? Okay, good. And the 7th one, let's see, that was the 8, the acoustic. Okay, I'm going to whisper in your ear, and just kind of tell me what you hear. I'm going to kind of lean to one side. I'm saying a word.
Eat.
Okay. Another word.
Dog.
Good. Okay. That's acoustic. And next is 9, the glossopharyngeal. I'm just going to have you swallow a glass of water. Just take a sip of water. Okay, good. Thank you. And number 10 is the vagus.
We're going to Vegas?
Vegas. See, I'm just going to have you just go ahead and swallow for me. No issue with that. And then the 11th is the spinal accessories. I'm going to have you lift up your shoulders and push back down. Okay, good. And then just, let's see. I want to have you turn your head to one side. Okay, and then push back the other way. Push the other way, turn the other side. Okay, good. And the 12th is the hypoglossal. I'm going to have you stick out your tongue for me. Okay, move it side to side. Okay, good. I'll have you puff your cheeks. Okay. Okay, good. Okay, now I want you to smile for me. Can you frown? Okay, good. All right, that's pretty much the cranial nerves. Next thing I want to do is I want to check your muscle strength. So the first thing I want you to do is kind of just take your arm up in the air like this here. You kind of hold your elbow like that, and I want you to pull like you were curling weights. Okay, good. Now we do this to both sides. Check your bicep strength. You hold your arm up again. Now I want you to push down on my hands. Just at your elbow. Okay, good. That's your tricep strength. Good. And then have you, with your foot, I'm checking your plantar. Push down my foot with your foot on my hand. Good. Now take your toe toward your head. Checking your dorsal strength. I'll check both sides, plantar and dorsal. And I'm going to go ahead and do your reflex. I need you to sit on the side of the bed. first thing I want to check is your brachial strength. Hold your arm up here, and I'm just going to I don't have the actual hammer, but just was hitting the brachial and check for a positive reflex. Then I would do tricep. I do the same thing, hitting your tricep back here. Check the tricep reflexes. And with your knee hanging off the side of the bed, I'll check the reflexes on your foot. I'll check both sides at the same time. Yeah, that's what happened. And I'll also check your back of your heel there. Check the pulses there. Okay, good. Okay, have you lay back down. Oh, another thing I want to do is just on your chest. I want you to close your eyes. You kind of tell me where I'm touching another cranial nerve and checking where I'm touching your face at. Okay. So what side am I touching?
My right side of my cheek.
Okay. Now.
My left side of my cheek.
Okay, good. All right. I'm gonna start with your lungs here. The first thing I would listen to, just first I want to look at your chest, see like any abnormality. Check the symmetrical of your chest, how it rises and falls. I don't see any scars, anything like that. I'm going to listen to your lungs. I started clavicles. Checking the upper thoracic area. Check base of lungs.
What are you checking there?
Pardon me?
What are you checking there?
I'm listening for lung for the equal, like any wheezes, any bronchi, make sure the lungs are clear. And now I'm going to go ahead and I would have you set up. I'm going to listen to your backside, have you sit on the side of the bed. Above the scapulas, both sides. Get that the third intercostal space, the sides. Just have to take a deeper breath. Okay. Go ahead and have a seat. Lay back down again. Okay, now I'm going to listen to your heart sounds. I'm going to start with your aortic, which is the second intercostal space. This is S1 sound. I'm listening for the lobes. Then I'm going to listen to the second intercostal space of the pulmonary valve. Central lobe also on this side. And third intercostal space is the ear point. I'm also listening for like any growth or any heart murmurs at all at this time. And the fifth intercostal space, tricuspid. Sixth intercostal space is pulmonary or mitral valve. Okay, good. Okay, now I'm going to have you lay flat. Just kind of scoot down the bed a little bit more. I'll do the abdomen assessment. First thing I'll do is you kind of look at all the quadrants. Again, checking for like any scars, any masses, anything abnormal, any distension. You can maybe get a history, like history of bowel movements, passing gas, that type of thing. Do you have any pain at all in your stomach right now?
Nope.
Okay, any history at all that need to be aware of? Okay. Start with the lower right quadrant. Then I would listen for 15 seconds, up to 15 seconds. Unless I didn't hear any bowel sounds at all, then I would be up to 5 minutes. Check all 4 quadrants. Take all 4 quadrants. And then I would percuss all 4 quadrants. Just kind of Any pain, any rebound tenderness, any distension at all?
No.
Okay. No mass is felt. Then I'll palpate all four quadrant, kind of. Okay. I'm just gonna listening for like any dull sounds, any tympanic. Tympanic could be over air. Dull sound could be more over the organs. Okay, I'll check the liver span, toward the mid-clavicular, come down. Once I heard the dull sound, shift the dull sound and make a mark. Come down the abdomen, go up. Until I hear the dull sound, make another mark, and I check the liver span, measure that. This time I'd also palpate for the spleen. I could also do this maneuver here. Palpate for the liver, right quadrant. Okay. The kidneys, do the duckbill. Go for the kidneys on the back. Okay. Pretty much for that. Now we're just going to do check your pulses. First thing I would do with the carotid pulse, I'm going to listen to the carotid for any growth. I have you turn head. Okay. I'm also for this thing, you sit back up again. Need your 45-degree angle. Come back up in bed. I'll be looking for any jugular distension right here. I don't see any. Have turned his head. Listen carotid. Okay. Then palpate the carotid. Okay. I'll check the radial pulses also. See if they're strong and equal. Get them aside. Check the popliteal pulse. And knee. Check the dorsal pediis pulse. The tibial pulse. I do that on both sides also. Come up, check the skin, check the nails, cap refill, see if they blanch, and then return to normal within 3 seconds. Do both hands, also do his feet. That's pretty much it for the assessment. Then just we'll kind of wrap it up here. Just you being a young male, probably know that you reach puberty. You kind of do like a monthly check with your testes. You kind of check for cancer. So what you want to do, like take a warm bath or warm shower when they're a little bit looser than normal. Just kind of feel them, look for like any abnormal bumps, any changes in the side, if they get any smaller, any like heaviness or any pain that you feel in that area at all. You can kind of contact your doctors and set up an appointment, kind of, but just something you want to check every month. You kind of feel yourself and just kind of make sure that nothing's abnormal.
Okay.
That's pretty much it. I appreciate your time today, and good luck to you. Thank you. I wash my hands, cover the patient back up, tell them go ahead and put his clothes back on, and then meet him out in the hallway.
Okay.
Okay.